Distinguished organizers, dear ladies and gentlemen, colleagues, I am very glad to present here Russian point of view on integrative medicine, only one part of this point of view. And you as a specialist in integrative medicine can find in all of these lectures some interesting, some useful, and you can integrate. You are integrators. Applause for integrators. So I want to present you some new presentation. This is presentation in 1 week. I will present it in the World Congress on Trace Elements. Nobody seen you. You are first who are seeing, who can see this data. So it's presentation of participant of World Congress on Trace Elements. It's very important that trace elements or microelements, it is only very small actors in biology, but their importance is very high because they can influence on demography, birth rate, morbidity, mortality, and in some diseases. So toxic elements and excess and essential element deficiency are presenting in 80% of humans in the world. One or more deviations in 80%. So if you measure only zinc, you see 40% of deficiency in India, for example, 20% in USA, and 30% in Russia. But if you see 25 or 40 elements in profile, when you are profiling the blood or hair, you can see that almost absolute majority of the population of the world are, have the deficiency or excess of trace elements. The next is, you can see that a lot of people are ingested by toxic metals or have deficiency. You can see in this slide. You can see also that if we found the deficiency or excess, we can give the good help not only for family budget, but also for country budget, because people which have the deficiency or excess are people which are ill or suffering of some disturbances, and if we spend $1, for example, for the zinc deficiency, we can save $5 because it is preventive medicine. We prevent the sickness, we prevent illnesses, we prevent death. So also you can see that in the investigations which were presented in different countries showed that trace elements can help for us be more healthy and make the good benefits not only for health but also for the budget of country or of person. So it's my introduction, because when we say about trace elements, we need to understand why it is important. Because absolute majority of people, if we investigate there, have deficiency or excess. Of course, rich countries, developed countries, has less deficiencies than pure countries, than developing countries. Also, in developed countries, we see less intoxications than in developing countries. But absolute majority of the people are living in developing countries, in transition countries, but not in developed countries. The next, my presentation is about the history of our ideology. You see that all religions born in East. All religions came from East. But West is developing very well, all religious. and all knowledge. It's very big prevalence of Western approach. In Russia, we always see on the Earth as a big biochemical puzzle picture where there are a lot of biochemical provinces which influence on the body content and on our health. In Russia, also it founded such life science as Microelementoses, the science which says that all chronic diseases or states of sickness are connected with trace element deficiencies. You can see this microelementoses theory. There are three groups of microelementoses: natural, technogenic, and iatrogenic. Very important that in Western countries, developed countries, more presented iatrogenic hyper and hypoelementoses because of using of lot of medicines, not always in right way. So iatrogenic elementoses we can found in 30% in Western countries. In developing countries where people are taking less medical drugs and less substances, we see less cases of iatrogenic microelementoses. Why I can say this? Because I am presenting Trace Element Institute for UNESCO, which is working in 28 countries, and we know in different countries the statistics on trace elements. So, next, bioelementology. We offered for the better understanding of influence of trace elements and other elements for our nature, the concept of bioelementology. Bioelementology, this is a new concept which explains how trace elements and others blocks of life are connected with other sciences. So it's a example of integrative approach. It's our proposal. You can use it or not use, but we think that it is right, and we use this approach in our medical working. What is bioelement? It's block of life. It's not only atom of element. It's ensemble of atom and some organic molecules which play different games in our body. For example, this was an excellent lecture about vitamin C. Vitamin C is not only working as only vitamin C. Ascorbate contacted with different elements, so we also can see the interrelationships between these blocks of life. Another, you can see our classifications of bioelements or blocks of life. Not only elements, but also simple molecules which are essential for the life. What is bioelements? They are not beings. Beings started from the cell. Bioelements are substances, yet substances which can be used for the building of the life. If we understand how life was built, we understand how to treat, because the illness very often started from some minimal deviations in physico-chemical substances in our body. So, if we have some problems with the trace elements, with the bioelements, we have problems also political, because this is bioresources. One nation needs more than another nation, one nation used more than another nation, and it is interesting for them. So I don't want to say more about this. Only I want to say our approach when we start to work in any country, what we are doing. We are investigating the reference range of the data in blood and hair and others, that to see what is normal for these people living in this territory, what is typical for them, that don't make misdiagnose, not to make the mistake when we make the diagnosis. For example, in Taiwan, a lot of people have mercury high. A lot of people, 60% of population has an elevated hair mercury. But it is not danger for absolute majority of them, because selenium level as antagonist of mercury is also high. So there are no imbalance in the body of Taiwanese residents. If we see high mercury and low selenium, we say that it can start the disease in this patient. If no, no. And this is wrote also in Minamata Convention, which was accepted a few years ago. When you have elevation, moderate elevation of mercury without deficiency of antioxidants, it's no disease. It's only accumulation which you can use because you are living here, genetically you are predisposed to this, you adapted to this food, to this environment, and this is no illness. So next, our approach is based in ICP-MS, using of ICP-MS. What we can find? We find that in Russia, selenium, we found selenium in 24-45% of the population. Zinc in 18-46% of the population, depending from the region. So Russia consists from 80 regions. In different regions, different deficiencies. Cobalt is most deficient in Russian population. I want to say, in comparison to Taiwan, your neighbors, Taiwan has only 5-7% of selenium deficient patients. When we say about hair analysis, only 5 or 7, between 5-7, no more. Russia, 45. So in Russia, it's a problem. In Taiwan, so only in some people or ill people or people with some troubles. Zinc deficiency is more widespread in India, Bangladesh, but not in Russia, and so on. So it's example, we made the mapping of the Russia, and we have the maps for each region, and we know which element is high or low in people living in the region. It's very good correlated with demographic data. These formulas possibly are not very easy, but you can see that if people have low magnesium, calcium, phosphorus, copper, or high manganese, mercury, in this territory mortality is higher than in others. So in this territory we can find more connections with these diseases, and we need to produce in this territory the special medicines or special foods, special diets for elimination of toxic substances or for substitution of deficiencies. The same is birth rate. In countries where zinc is high, normal sodium, iron, aluminum, silicium, we can find zinc. Attention for the zinc. Zinc is stimulating spermatogenesis. In these regions, we see more birth rate, higher birth rate. So in this picture, we can demonstrate that it is connection between trace element status of individual persons and population and demographic data. I think this is very important. You can see about hair analysis correlation with the different diseases. You can see in Russian population, if in region people have low calcium, cobalt, potassium, magnesium, sodium, and phosphorus, this is regions with a very high score of cardiovascular diseases. It's not new from the physiology or biochemistry, But we know that this region needs more attention for these elements. We need to produce here new fertilizers for agriculture, new products for humans, for the citizens, and new medicines, and so on. So it's also political, interesting political impact of this, because health standard, demography is also politics. So it's demonstration from our book published in Springer Verlag about the selenium and mercury. I said that if selenium is low, mercury is high, you can see how much significant changes we can see in the patients. So if in region or some country or in some person we see imbalance of selenium mercury, very important for this region. I think for Philippines more than for Taiwan because of environmental problem and metal pollution and so on. But I'm not sure now. In few years I will say more precisely. But you see that it is a lot of connection between imbalance between toxic element and its antagonist. So if we see this, we give not only multi-element formula, we can use only selenium if you see only selenium deficiency. It's enough that to cure, that to help, that to prevent. Silk Road, it's a big program from the Chinese government, and we proposed this program of investigation of Silk Road countries for Silk Roads. Then you can see we are working in different countries. We present our services for what? That to improve the health of people in different countries, and to investigate how we can help more effectively for these people. So our approach is, before investigate, know the special predispositions in this population, and only after that start aggressive marketing, selling, and so on, because you can make mistake. No, you know that all substances, even vitamins or trace elements, are toxic in overdosage, can be toxic, and in deficiency. You have to be sure that you do good. Of course, in cancer, big mega doses of vitamin C or selenium, it's good idea because it's less deranging than chemotherapy or radiotherapy. And sometimes, or oftenly, I don't know this, I'm not specialist in using of mega doses of vitamin C or selenium or others, but sometimes are more effective in the treatment of cancer patients. And this is why I'm very thankful for American friends which present very good lectures about this. In Russia we not use such big dosage, but why not? We need to do this, but only in hospitals, in clinics, not as an experiment, self-experiment in the people. So we have the good support from different countries. Also we work with some American universities. Why we have so much partners? Because in different countries there are different schools of knowledge, different approaches, and we want to integrate these knowledges the right way, best way, for each country, for each group of population. It was a general. Now I want to go, now I want to go to the example of using our approach in one disease, very popular disease in different countries, from America to Japan. This autism. So we investigated autism. Why? Because it's a good example of imbalance of trace elements. Very often scientists and doctors found in these children elevation in mercury, in other toxic substances, deficiency of elements. There are huge amount of articles in the literature you can see about autism. Once more about bioelementology. Before investigate autistic children, we also put that in our mind, that our point of view is to calculate blocks of life, toxic blocks, and compare what is more important for this disease. Only after that, to investigate as group and as individual. And we also wanted to find there's some typical deviations for some groups of autistic people. Children, in our case, they were children. So, bioelementology, you saw this. About bioelement, you saw this, you saw this, you saw this. So, if we have there one patient, or not patient, a relatively healthy person, we can make for them some tests. For example, hair, blood, saliva. Doctor choose what we want to investigate. If you want to see the picture, chronic picture, better is to use teeth or nails or hair. If you want to see influence of vitamin C, of course, better is to investigate blood or saliva or urine, because they reflect more quickly this. And if we investigate people and not see nothing, only small imbalance, can we help for them? Yes, we can help for them to balanced diet, for example, or more sleep, or more work with fitness, more visit things. So, unbalanced nutrition and environment can derange us, but we can help by food. We not need any medicines, only food, lifestyle, possibly no more. But if these deviations, which we see in hair, for example, long term, it can be disadapted. Person can be disadapted to this deficiency, and then not only diet, but food supplements as concentrated blocks of life we can use. And also we can help for them to adaptate the body organism to this environment, to this diet, to this lifestyle, and so on. Clinical nutrition started after, then where started the pre-disease, reduction on functional reserves. And disease needs more and more active influence. For example, mega doses of vitamins or others. But specialists know this better. So, in each of these stages, we can use elements from the start to the end. In the start, it is a compensation of deficiency or excess. In the end, it's helping for the treatment. We published our articles in famous journals together with scientists from Saudi Arabia, Romania, Bulgaria, Norway, and other, Norway. Why? Because also we want to compare. There is a difference in children with autism living in other different countries. And now I can say no. Autism is autism in the USA, in Taiwan, in Saudi Arabia, in Russia, Romania, the same. Norway, the same. It's very important also. So it's not only due to geography, to some foods. It's more common problem for human body. So, autism. Autistic spectrum disorders were described firstly Dr. Kanner 80 years ago, or 70 years ago. And in the last decades, we see lot of publications about trace elements as essential elements and metals. You can see the more attention was on action of toxic substances in autism. But we see not only one element, but set of elements which can be responsible for negative effects in autistic spectrum disorders. You can see in this slide there are a lot of contraindications in the literature. One people say mercury is high, another people say mercury is low, lead is high, low, and so on, so on. A lot of meta-analysis show that some articles are not correct, but they are presented in the internet and people are using them wrong way. So you can see that it is a contraindicative articles, but mainly we see that really toxic substances are higher in autistic children and essential elements are lower in autistic children. And the same elements are in different countries. It's very important. So, it's the materials and methods of our investigation. I don't want to say more about the methods, analytical methods. It's not for medical doctors, for chemists more interesting. But if you will have questions, you can see this, or you can take a copy of this presentation, use the all literature if you want. So, what we found? We found that children which have autistic spectrum disorders, in comparison to control group, have lower chromium, lower hair iodine, higher selenium, very important, higher selenium, lower vanadium. Chromium, vanadium, what's the elements? And elevated selenium. This is typical for diabetes type 2. They have no diabetes type 2. But these deviations are typical for diabetes type 2. In America, a lot of investigations showed that autistic children, when they are adolescent or adults, became diabetics 4 times more than another people. So autistic patients, adult autistic patients, 4 times in America have diabetes type 2. Toxic substances. We can see a lower level of beryllium and a lower level of antimony. So, in intoxication, you can see not only elevation, see on the mercury, also lower level of elements in hair. Is it possible in intoxication? It is reflection, not intoxication, but weak elimination of trace toxic elements from the body. Because we have the big experience of working with the workers which are contacting with toxic substances in the workplace. When they are young and strong and healthy, hair contains more lead, mercury, arsenic than when they are old. Because when they are old, their capability to eliminate hair route of elimination of elements is lower. And they have less toxic substances in hair, but more in blood. Young workers have less in blood, more in hair. And the same, I think the same is working in children. Next figure, we can see that if divide children 2 groups, 2, 4 years old, and 5, 9 years old. Why we divide it? Because we know that brain is developing very well till 7 years old. Then, if you not reach big success in treatment of autism, you will be not successful, very successful. You can be a little bit successful. Why? We see in this picture, what we see, that in younger people, the imbalances are more prominent, more imbalances. Deficiency of chromium, deficiency of iodine, deficiency of vanadium, and excess deficiency of arsenic, deficiency of boron, deficiency of beryllium. So, in small children, deviations are more prominent than in older children. But in older children, we have no effect, clinical effect, when we are using trace elements. So, effect is maximal effect. It explains why we have effect in treatment of the children in early age. So, the top problem is to find children predisposed to autism as soon as possible. And now we are working this work with Imperial College of London, this work, and we found that yes, we published it accepted to the publishing in one very famous journal, that women which born autistic children are deficient, more deficient than women which born no autistic children. So problem is in mother. If we see in hair test of mother, she has chromium low, vanadium low, iodine low. This is risk group for autism. We have to be more careful with the child, because also is very important that mothers of these children oftenly have diabetes during their gravidity. So, if we see the patients with 5, 9 years old, we see only selenium high. Who is interested in trace elements? No. Only few diseases have elevated selenium. Diabetes, metabolic syndrome, some neurodegenerative diseases. But it means that not selenium is high. We can check up it. If we check up the blood content. So what we see when you can see the summary, key findings in this. That's what I said. Yes, you can see one more. Then we divided these autistic spectrum disorders children for different groups. You can see how much different clinical groups are there in autistic spectrum disorders patients. So autism, it's not the one diagnosis. It's a lot of different diseases under the name of autism. And we investigated it. And what we found? We found that control, childhood autism, and atypical autism. Childhood autism and atypical autism are different when divided. And we see lower cobalt in both groups, but mainly childhood autism, higher selenium in both groups, and also lower vanadium. So if we divide into groups, we see the different results. So it's important for the treatment. But also we see selenium excess in all groups. Next, we can see the toxic elements. We see that toxic elements are lower in nickel, for example, in childhood autism, but higher in atypical autism. So atypical autism can have more patients with the intoxications. Also, macro elements. We can see that it is a lower level of calcium, magnesium in children with childhood autism, more widespread form of autism. If we see the pictures, you can see that they divided into different groups. It means that when we have children with autism, we need to use profiling, metal profiling before supplementing, because not all of them needs it. And if you give more, but in right way, you will be right. You can help more. In my practice, I saw children which started to communicate and to speak in 2, 3, 4 weeks after the treatment by trace elements. For example, manganese, or copper, or zinc, or iodine. It's not so often 2, 3, this is a record. But mainly in 2 months, we have the very strong improvement, evident improvement of somatic status and psychiatric status. So children are more healthy, parents are satisfied, specialists are wondered. So what we can see, autism, atypical autism is more stable hair trace element profile than childhood autism patients. So we can be more successful in childhood autism treatment by trace elements. Another key findings. The only hair trace element increased in atypical autism patients is selenium. So selenium is a linkage of both groups of autistic children. Nickel exceed in atypical autism. And what about serum? We spoke only about hair, that to see profile, chronic profile of these children. What about serum? In serum we see the similar picture. We see low chromium, we see low, not high, selenium. So it was losing of selenium, because in hair selenium is selenium cysteine, connected with cysteine in hair. So selenium is deranged metabolism of selenium, and we need to, it is needed to give selenium for the children with elevated hair selenium, because they're losing. In case of chromium, no, it's deficiency, but in case of selenium, it's losing. Inversion, you can see, inversion. Similar to hair, inversion. And also we see lower toxic metals in atypical, autistic spectrum disorders. Another slide, you can see that children with, when divide children on atypical autism and childhood autism, we can see, wonder, we see that more deviations in serum than in hair. What it means from the physiological point of view. Not all people understand this. We have a big experience, hundreds, thousands of patients. What we can see, that if patient has a normal homeostasis, you understand what is homeostasis, balanced, they can have elevation in hair, decreasing in hair, because it reflects nutrition, environment, for example, sweating, and some local problems, using of some cosmetics and so on. But if patient is really patient with deranged control of metabolism. With this homeostasis, there are more deviations in blood because it's disease. What is disease? Disease is no physiology, pathology. Hair reflects environment very well. Hair reflects the elimination very well. But it is one way indicator. No one element goes from the hair back to the body. No. But in blood, it's well balanced. So we see that in atypical autism, we see less manganese, less selenium, less also arsenic, less nickel. So we can use these elements, even Ayurvedic medicine with the elevated arsenic, why not? Nickel is acting to the DNA. You know this. For the nucleus, where concentrate nickel in the cell. So we can use for atypical patients some elements as a monotherapy or some additional therapy to main therapy that to be effective. And in the childhood autism, we see elevated copper, what is described in autistic literature about the autism. There are a lot of articles about elevated copper. We also see this, but not in all autistic children, in childhood autism children. And if you read the book, and in absolute majority of articles about autism, they wrote, autistic children, you see how they are different. So you cannot use this in this case, we cannot that in that case. We need to know profile before start treatment. Because if it is the main law in physiology, in therapy, not only in physiology, if you have deficiency, you can help by this element. If you have no deficiency, you cannot help in physiological way. If you have deficiency of iron, you can have anemia. If you have deficiency of oxygen, give the patient oxygen and you can see the very fine effect in 1 second. So the next, you also see that in serum of childhood autism, elevated aluminum, elevated zinc, elevated manganese, but in atypical children, manganese is lower. So, one very important point. When I said about the quick treatment of autism, all of these patients were patients with manganese deficiency. Atypical autists give the best result on the therapy by manganese because they have manganese deficiency. You understand? It's very important. 2, 3, 4 weeks, 2 months, and you see the very good effect from the adding only one substance. It's not say that you cannot use another methods. Yes, but it is also important if child has deficiency or excess. So next, you can see key findings. And also we see that they are similar in blood and in hair to diabetic metabolic syndrome patients and patients with neurodegenerative diseases. What is autism? Mixture, but we see some typical features. It's very difficult to see, but the main idea is if the patients are elder, they have more stable hair content. It seems that it is no changes in elimination, changes only inside the organism, and we need not stop only hair test, but also use use blood test for real diagnosis of deficiencies in these children. So, serum is directly associated with hair cell level only in atypical autistic spectrum disorder group. Next. Next, I want to say that also toxic metals are different in autistic children, and you need to understand that low level of lead, of beryllium, of nickel in these children means that this is a weak methylation, weak elimination of toxic metals. So in these cases, we need to help for the children. For example, chelation therapy or antagonistic therapy. It's explanation why chelation therapy in some cases is very effective too. Because children's body cannot eliminate toxic substances. They collect more and more and more. And what we use in our practice, amino acids, different amino acids, very oftenly correlated with excess of toxic metals. And when we give amino acids, we also can help for these children. Norway, Saudi Arabia, the same. I don't want to stop more because I said that in different countries the same picture. It's very important that it is really disease, not local endemic disease. It's a real disease which can derange population in different countries. You can see the different analysis, and after supplementation, you can see less deviations. So before supplementations, more deficient children, more children with excessive toxic metals. After supplementation, as a control, analysis we are doing as a control, we see that improvement, clinical improvement is showing improvement in laboratory tests. So correlation between laboratory test improvement and clinical improvement. Amino acids the same. Different cases you can see. If you're interested, for you can have this in this presentation. So some practical recommendations. So patients, there are a lot of articles about trace element deviations, but not so much patients are diagnosed by this testing. We showed in this investigation that it is very successful for the helping of the people by different supplements which are presented also here from different firms, present the same. But what to choose? What to choose for this individual? Analysis helps for you to understand what to choose. Only personalized diagnostics of trace element status in children should be used as a basis for development of further micronutrient therapy. Estimation of trace element status of the individual with autistic spectrum disorders, as well as with other disorders, should be based on assessment of the level of trace elements and all possible biosubstrates, blood, hair, urine, nails. You also saw that not enough only hair test. Sometimes we need to check up some other elements. But if we know what is typical for autistic children, atypical autism or typical autism, we are more sure that we are doing well when we treat our patients. The main concept of treating autism spectrum disorders is a complex neurodevelopment disorder with multifactorial etiology involving interactions between genes, environment, and diet. But we need to remember that we can use hair and help to understand, to see in this deep hole. It's named autism. Nobody knows now what is autism. Only we know the features of autism, appearance of autism. But the nature of autism is very complex, But trace elements, when we measure amino acids and other substances, when we measure before treatment, we can be more sure that we can be more effective in these cases. You can see we have a lot of publications this topic in English language. You can see it. And I say you thank for your attention. You are very patient. You are not patients, you are very patient. I am very lucky that eating not disturb the understanding of me in case of you. Thank you very much.